name's Alan Barronian. Born in Tacoma, raised. I went to the University of Washington for undergraduate and my medical school. You'd have to say I'm a Husky through and through. Yeah, I've been really blessed to be in Burien for my entire post-residency career. So after fellowship, I moved here and I've been in the same practice the whole time. I would say the best part of being in one place for that long is the relationships I've developed with my patients. It's not uncommon for me to take care of 3 generations in one family. I have kids that I treated as toddlers that bring their kids in when they have an orthopedic problem now. So it's really been an honor to take care of these families. I love almost everything about orthopedics. I love the technical aspects of it. I love the problem solving. We get to take care of people from newborns to 105-year-olds nowadays. I love the one-on-one relationships. I really like the surgical part of it and what that entails. I really enjoy doing all things orthopedics. My practice has been very general over the years and I really like it all, but if I was pushed, I would pick 3 areas that I would consider probably my favorites. I really enjoy doing joint replacements. I love the technical aspect of the surgery. I love the problem solving that goes into it, the preparation. Patients that have shoulder and hip and knee replacements tend to do very well, so it's a really rewarding, special thing to be able to take care of these folks and see them do well. I did a sports medicine fellowship, so sports injuries have always been a special interest of mine. I'm kind of a sports nut, so it fit real well with me, but I take care of a lot of ligament injuries. We do ACL reconstructions, torn cartilage, torn rotator cuffs, a lot of arthroscopic surgery. Again, it's a very interesting field. It's very rewarding. And then finally, even though it can be kind of tough on your own lifestyle, I very much enjoy taking care of broken bones. So fractures, a lot of them we can treat non-surgically, but when they need to be fixed, putting these puzzle pieces back together and getting them fixed and getting them healed. And it maybe sounds cliche, but seeing people come in broken and you put them back together, they heal up and they move on and get their life back, it's pretty special. A long time ago, we have 5 orthopedic surgeons in our practice, and together we can take care of virtually all orthopedic problems in our practice, which is Proliance Southwest Seattle Orthopedics. But we decided quite a while ago that we wanted to have a personal, hands-on approach to every patient visit. Everything that happens, we want to be involved in. So if somebody comes to see me with a problem, they see me for their first visit. They see me for any follow-ups, which is important because a lot of the things we see don't need surgery. So they're coming in for a tendonitis or something that we're treating. If they need surgery, then I see them for their pre-op visit. If we do surgery, of course, I'm doing the surgery, and then I will see them at every one of their post-operative visits as well. So it's just something we decided. A lot of people tell us it's not a great business model to practice medicine, but philosophically, we just believe it's the best way to provide quality personal care, and so it's something we're committed to. We even put on our own casts. I have a lot of students come through and job shadow me. Just by happenstance, that's been going on for a long time, and they'll ask me, well, what do you have to do to become a good surgeon? And when I was in medical school, an old general surgeon asked us that, and of course, none of us got the right answer, and he said the most important thing is integrity, and that's exactly right. So it's fun to look back and say, not that I didn't believe he was right, but he was right. And then secondly, I've learned attention to detail, and that's not just in the operating room, but in the office, when we're seeing patients in the hospital, you really have to pay attention to detail. And then I think the really top flight surgeons marry that attention to detail to continuing education. You have to stay up to date on the most recent research, on the innovations, the new techniques. If you don't, it'll pass you by. And I think if you can do those things consistently, and you take care of your business, you will be a good surgeon. Oh, I just have to say once again, I really love what I do. I'm getting a little older, and so I can't lie and say people don't ask me how long I'll practice, how long will I keep doing this? And I have to think that as long as I'm loving what I do, I'm learning, I'm providing high quality care, and at the end of the day, I really enjoy being an orthopedic surgeon. I don't plan on quitting anytime soon.